Good morning and welcome to Primary Children's Pediatric Grand Rounds for our annual Gillian Abbotts Memorial Lecture. I am Miguel Canacal, pediatric hospitalist and course director, and thank you all for joining us this morning. Good morning to you. You can ask your questions of Dr. Tait anytime during the presentation in the live chat, and I'll ask for you when it's question time. Don't feel like you need to wait till the end to ask. Just please type those questions in as you think of them. We will leave the video up all day, even multiple days, and then post it in the archives online within a week. And to claim credit within 24 hours, you use code 7952. That's 7952 on Cloud CME. And please claim this, whether you need it or not. We need it, so you can claim that credit. Thanks so much. First, a brief safety story. We are highlighting the basic error prevention technique called stop and resolve. So in the pediatric ICU, a patient was ordered an IV magnesium replacement of 2 grams, but the patient is only 29 kilograms. And so when we were doing our double check, we realized the dosage was not appropriate for his weight. And because of the error prevention technique of stop and resolve, that's where the double check comes in. This error did not reach the patient or result in harm. And that's what we're looking for, the basic error prevention techniques using every day. And now Dr. Chuck Norland of General Pediatrics will introduce our Gillian Abbotts Memorial Lecturer.
Thank you, Miguel. It gives me great pleasure to introduce Dr. Tait, one of my dearest friends, as the 30th Gillian Abbotts Memorial Speaker. Gillian was the first daughter of Drs. Bruce Abbotts and Marla Struben. She died of sudden infant death syndrome in the spring of Bruce's 3rd year of pediatric residency at Primary Children's in the University of Utah. Marla completed her pediatric residency at the University of Colorado, and during the last 2 years of Bruce's residency, practiced general pediatrics in West Valley City. Marla and Bruce moved to Spokane, Washington in 1990, where they practiced together until their recent retirement. They now live in Oregon, and I hope are listening, or watching also. The lectureship was initiated by Lucy Osborne, an outstanding pediatric faculty member and a mentor of Bruce's, to promote child health through educational experiences, emphasizing aspects of pediatrics that prevent disease, promote health, and improve medical practice. Today's speaker, Dr. Tait, was also a faculty member here at that time in pediatric neurology. An Alabaman to the core, she earned her medical degree at the University of Kentucky and then completed both pediatric residency and neurology fellowship here. She served on the faculty from 1984 to 1998 when she became the director of the Bureau of Children's Special Healthcare Needs at the Utah Department of Health. She moved to the American Academy of Pediatrics in 2005, where she has served in a number of leadership roles, currently as the Academy's Chief Medical Officer. I am sad that she couldn't return in person for this lecture. She brings much joy to those she meets and gives them great hugs. Nevertheless, I'm very happy to turn the screen over to her to talk about the impact of the pandemic on several aspects of pediatric care. Dr. Tait?
Good morning, everyone. It is such an honor and privilege to be with you. In this way, I just wish I could safely be with you in person. I want to truly thank you all for having me be a part or present this memorial lecture, and indeed I was there when the Abbotts were there, and that makes this even more special, so thank you for this honor. I feel like I'm coming home. As Chuck said, I was there for many years. I've been at the American Academy of Pediatrics for 15 years, but it just seems like yesterday that I was there with you. So it means everything to me today. So today, we're going to talk about the mental health impacts of COVID on children, youth, families, and I will tell you, and on us as caregivers, as providers, as physicians, as colleagues, as team members. Wow. It's been a year. Sorry, let me just quickly say, no conflict of interest. It's been a year, and today we're going to talk in terms of recovery from disasters and pandemics, the impact of mental health, and the well-being of all of us. And I'm going to sprinkle in a lot of strategies and resources for intervention. So hold on. There's a lot to cover. So 1 year. Think what you were thinking a year ago. I think in March, when we decided at the academy that we would just try to see how we could do if we were actually working from home. That we have about 470 staff in Itasca here in Chicago, and we thought, well, we would just try it. So it's been a year, and we're all still at home, and we are also not even thinking of going back until later this summer, if that time. So wow, there's a lot going on. When I think of COVID, and we often talk of COVID in the context of 3 pandemics, right, in the last year. So COVID, the economy, racism, other people add other pandemics, but it's a lot. So this is a slide every week. So we couldn't, at the academy, we couldn't really figure out how to even find out how many children were testing positive for COVID. And so, to make a long story a little bit shorter, Dr. Lynn Olson and her team started going online and looking at every state. So every week, every state, on any of the data they have, they collated that data to look at the number of child cases in the United States. And whether it's a little bit funny to think about this, that we would have to do that, but we have, and we did, and it's being used by some of the federal organizations. So that's great. You certainly can see the scope and the numbers. The good news is that the latest one we just added this week from 211, and so there's a little drop off as there has been with respect to the adults. So there's hope. There's always hope. But here are some of the numbers. So there's still an increase of about 99,000 new cases in the past week, and in the past 2 weeks, about 216 new cases. These are the cases that are reported, right? And in the databases at the state databases. So the good news is that severe illness still remains relatively rare among children. So they're the numbers. Here's what we're talking about today. I actually like this slide. This came from a training manual for mental health and human service workers for any major disaster from SAMHSA. And so I think when we're looking at this, on the left is the emotional highs and emotional lows. And I like that they do up to 1 year. And then they look at after the anniversary. So here's where we are after the anniversary. And this document speaks to reconstruction and a new beginning after a year. I think that we can have hope in that because of the vaccines. But we are also, even during what they call reconstruction and a new beginning, we all are working through grief and coming to terms with what this last year has been like and what we're facing going forward. But it fits perfectly with what we're talking about today. The pre-disaster, the warning, the threats, the disillusionment, and buddy, have we all been disillusioned? But still, there's hope. Here's where we are with the question mark. And this is what we're talking about today. So here's our shared vision. Optimal health and well-being for all children, adolescents, and young adults. And you're always going to hear me, and thriving for all of us somehow in the midst of all of this. And we're going to talk sometime about that. So as a neurologist, you know that I'm going to talk a little bit about the basics of early child brain development. And you've heard this, hopefully you've heard it a million times. So this is the early childhood development model. Jack Shonkoff and others have looked at this. So what we want is the healthy developmental trajectory. And that's, we're going to be talking about stimulating experiences and environments and supportive relationships. However, we are also looking at significant adversity and toxic stress. Now, this is not going to be the talk on ACEs, adverse childhood experiences, but a lot of what we're talking about could be considered an adverse childhood experience. So if we can't counter the adversity, then we're going to be looking at impaired health and development, and we can have lifelong impacts on this. We hope not. But what we're talking about today is not having that, is looking at the supportive relationships and experiences. So here's what I started to mention. Here's what families are facing: inadequate systems of support, inequities, and boy, we're going to talk about this a bit in the early childhood education systems, really inequities in that. Poor access to mental health care. People have been dealing with interpersonal and structural racism, but surrounding all of this is isolation and grief and fear and economic impact. And when I show this slide, I think, wow, that's sad, right? That's what people are dealing with right now. So hopefully when we finish today, we'll have some ideas together on how to make an impact when people are facing this. And this is just looking at it quickly in a different way, the impact on children and adolescents. This was from Tina Chang and others from the Pediatric Policy Council. Same principle, different impacts. The first one is just the morbidity and mortality. One of the things they talk about is a lot of children live in families, two-gen families, and live with their grandparents, and you're worried about giving the grandparents, bringing COVID into the home. 4% of all children are raised by their grandparents. So that's the first impact, and the multi-system inflammatory syndrome, MIS-C. So the second impact is what's happening in the community: food insecurity, unemployment, the education, the disparities, and the disparities are just worsened through all of this. What we're talking about is the behavioral and mental and behavioral. So when I'm saying mental health through all of this, I mean mental, emotional, behavioral health. You won't hear me say all three of those, but that's what we're talking about today. What's happening with child abuse in the context of all this stress? We talk about, someone said the other day, well, how's your stress level? And on a scale of 1 to 10, where's your stress level? And this was a physician who said, oh, about an 11, just about an 11. I'm like, so we're all dealing with stress. And I think it's even more important for us to be thoughtful of that and to be thoughtful of others and kind. So we talk about delayed care. The immunization piece is huge, the under immunization now. You've seen the new numbers on obesity, staggering with respect to what's happening along those lines. So here's one other piece. This just came out recently, very recently, in the Journal of the American Academy of Child and Adolescent Psychiatry, where they did a systematic review on social isolation and loneliness, on the mental health of children. And you may want to take a look at this article. It's pretty remarkable and concerning. But one of the things it says in the results: social isolation and loneliness increase the risk of depression, possibly anxiety, at the time at which loneliness was measured, and for years later. So we're going to have to be thinking about this. You're going to be dealing with it. We're all going to be dealing with this for a while. So we did this in a grant that we had a few years ago. And here's what I have to say to you all. Your impact on kids with toxic stress or who are stressed or in this COVID environment will be meaningful, tangible, and forever. So I cannot start a presentation without saying thank you. Thank you for what you're doing for children and youth and families and for each other. And it will be meaningful forever. Okay, a couple of more articles. This was back this past summer. It's gotten a little bit worse since that time, but a third of the parents who were surveyed here talked about worsening mental health in their families, worsening behavioral health, loss of childcare, and I can tell you the number on food insecurity has certainly gone up. Depends on how you measure it and who you ask and where you ask, of course. So in the midst of all of this, we're talking about child health disparities. So the child health disparities have just worsened in this. Here's where we talked about before COVID, the opportunities for prevention and impact for the disparities. But look at this, look at these roots, right? And you can link directly from these roots to what's happening with COVID, the educational inequities, the poverty, the adverse childhood, you can read it, the social determinants of health, access to care. We talk about the interaction of climate change, COVID, and mental health. So that intersectionality with respect to environmental threats. So, okay. So, wow. What's a person to do? Great, Fan. You've just set up what all the issues are. What should we do? So I will say, as we say to people when you're talking to your family about COVID, there are certain things that we don't have all the answers to. And the answers aren't the same for every child, right? And are not the same for every family, and are certainly not the same for every healthcare provider. So our role in this, and this is just at the highest level, is provide support to children and families. We provide advice and strategies on coping and resilience. We triage. But those of you who know me also know that I've always talked about family-centered care and what that actually means. So it's that therapeutic alliance. And how do you start the conversation? Well, you ask. And again, this is not just about primary care. It's about subspecialty care too. Ask about basic needs. Ask about what they're worried about. What's going well for the family? You can actually ask that. You can ask a question like, this is a stressful time. What are some of the problems you're dealing with right now? But also, where do you look for strength? So we're going to talk a little bit about strength-based care and what that means. Now, the problem is when you say, what are some of the problems you're dealing with right now, you have to have a response to that, right? Sometimes you just have to listen. And sometimes you need to have the resources and know where to go with this. All right. So for the rest of this time when we're talking about children, adolescents, and families, we have up online, and you can access this through the slides and otherwise, interim guidance. So we've put out, from the Academy's perspective, we put out a lot of interim guidance with respect to COVID. One piece that was just updated January the 5th is what we're talking about today. Interim guidance on supporting the emotional and behavioral health needs of children and families. So in case we finish this discussion today and you think, well, where are those resources? Where do we need to go? What do we need to do? I went back and counted. If you access this interim guidance, there are, ready? 54 links within that guidance 54 links to specific resources and help that you can use with families and others. So hold on, let's talk about this interim guidance. So a lot of this you know, because this is pediatrics, right? This is what we do. This is bread and butter pediatrics. But let's talk about the emotional and behavioral responses among children and adolescents. So big range of signs and symptoms. If you're thinking about infants and very young children, you certainly can have a disruption of physiologic functions like sleep and toileting and feeding. You may see regression. In older kids, you can see internalizing symptoms like withdrawal and fearfulness and anxiety, or externalizing symptoms like oppositional behavior, irritable behavior, argumentative, aggression, somatic issues too. So think about what we're saying. Families are stressed to the max, and now you're going to have the severity of symptoms that we're talking about here. And if we look at the severity of symptoms, what we know is that it's so variable that you have to ask about those symptoms. Are the kids getting adequate sleep? Are they eating? Is there difficulty concentrating? Is there dysregulation of mood? Those kind of things. Is there anxiety, and is there depression? Some of the other factors influencing the impact and manifestation is that we all have different temperaments, right? So there are certain children that actually are easier going, right? And so they can do more, they can respond more, they can do things better. And so you have to look at individually what these kids are actually addressing. So how do you evaluate the impact? You've asked these overall questions, now what? So here are just 5 little bit different areas to think about. So the social determinants of health, and there's a lot of discussion about whether we should be calling it social determinants of health or we should be using other terms. But for right now, we're talking about SDOH, social determinants of health. So you need to screen, right? Screen for food insecurity, for stable housing, the economic impacts on families. I think one of the social determinants of health right now is internet connectivity. We never asked that before, but if you're looking at being connected to other people or remote learning or employment or access to healthcare, you need to have internet connectivity. And that is really variable, really variable. And let me just speak just for a moment about the remote learning piece of that. So when we talk about disparities, part of the disparities we're seeing is in the rural areas. Chuck mentioned I'm from Alabama, and I'm from very rural Alabama. And I can tell you, yes, we do have internet there. And I can tell you, yes, it's not very good, even with people who could pay for it, right? Even with people who could afford it. And a lot of people can't afford the best internet. It's still, that connectivity is not good. I have a niece that's a school teacher, and she said, we have essentially lost a year with the students that I'm teaching. So I think that remote learning, we need to ask how that's going and what that means. We need to be checking in on the parental and caregiver well-being in the context of them now being teachers too. So they're doing childcare and teaching and work and trying to make sure their kids still continue to learn. So that's a big issue. We'll talk more about childcare a little bit later. So children and youth with special health care needs, the questions that we address with that as neurologists and pediatricians and healthcare providers is, are they getting the specialized medical services that they need? What about therapy? When they need the therapy, how are they getting that? Do they have continued access? Are they actually losing some skills there? If there are behavioral issues, are there structured routines? And what's happening with those structured routines? They may be used to being in school in a very structured environment, and now they're home. One thing that you'll read about if you look at this guidance is, what about the loss of respite services? All big issues. So a couple of other things to really think about, and we'll talk a little bit more here too, and that's what's happening in the child welfare system. So children and families that are involved in the child welfare system already have unique needs. They've already faced complex trauma and loss. And now, how do you do this? How do you help them? And there are some specific links in the guidance on some resources for this population. We've spent a lot of time at the Academy looking at the juvenile justice systems, from everything that says families still need to be able to visit safely, but at least initially we saw increased isolation, and there was increased exposure risk. So those are all the things to think about as we're actually evaluating the impact of what's going on. Okay, well, that's a lot, right? That's a lot, and you're trying to get the families back in for well child care. And yes, I understand bright futures and what we're asking you to ask, but when we say bright futures, the first thing we always ask, or are supposed to ask in bright futures, is what concerns do you have to the families? And this is the time when we're asking, how's it going, right? What are you facing? What's happening there? So let's spend a little time looking at that anticipatory guidance. So we talked about this a little bit earlier. The infants need to feel that attachment to nurturing adults. Toddlers, and I'm just hitting at the high places here, toddlers need that structure also, particularly as they're striving to master autonomy. Preschool age children can have that magical thinking, and they need reassurance about the realities of their safety. School age kids may really have heightened fears about the virus and excessive, worry and worry about the risk in school age and older. And then we have the adolescents with a sense of loneliness and isolation and uncertainty. So those are all things to ask about. Those are all things to look at and think about. Just quickly, I mentioned this earlier, but the communication, particularly with adolescents, as always, that communication just has to be open and honest throughout. I think that you need to, what we say to families is what we say to pediatricians, right? Honestly answer the questions and acknowledge that we don't have all the answers right now. It's really important that we do that and not say things that aren't correct. If we don't know it, we have to say that we don't know it. But we also have to say we don't know, but it's our job to keep you safe, and that's what we're going to do from a family perspective. I think we have to really watch the exposure to the news reports about the pandemic. I spoke to someone who has a 5-year-old child and actually saw this picture and this little 5-year-old, and they are very cautious about the TV being on and about the news, and this 5-year-old child's not sitting there with them when they're watching all the horrible things on the news. And this little 5-year-old, who is precocious, but had drawn this picture, and it looked kind of like the sun, with things actually coming out of this bright orange thing. And this mother, who's a wonderful, wonderful mother, said, oh, you drew the sun. And the 5-year-old said, no, Mommy, I drew COVID. I drew COVID. Wow. So when we think kids aren't hearing, when we think kids aren't watching, you know this, but they are. So I think this is really important to talk to families about. And so they need guidance on the screen time. When we talk about distancing, I think it's important for us to say physical distancing, but not social distancing. And there are a lot of guidelines in this information and in this interim guidance about that. And there are guidelines about screen time. We need to be very selective about that, as I just mentioned. And real-time communication with friends and family is really important. Okay. So, wow, this is so much, right? So one thing that I think I just want to go positive on you for a little bit here. And those of you who knew Paula Duncan, our friend and colleague, Paula, you taught me this, strength-based approach to care, and promoting resilience. So when we're looking at all of this and we're thinking, let's see if we can go back one. When we're looking at all of this and we're thinking, what's good about this? Is there anything good about this? I think we have to talk to families about promoting resilience. So think about, you got to be present, you got to be nurturing, you have to be empathetic, but also you got a lot of time to spend with families together, more time than you had before. So you can be happy to be in each other's company. You can revisit family culture or beliefs or anything that's positive. I have seen, if you go online, I've seen all kinds of things that people are doing with their families. Their creativity, their passions, their strengths. When it's safe to do so, you see adolescents safely volunteering in their community at the food banks. So it's just reframing this. So let's see what we can do together. How are we strong as a family? And I think asking that is really important, which is the whole issue of saying what's working, right? Tell me what's working. Hold on to that, but tell me what's working. So promoting that resilience is absolutely critical. In the midst of this, though, there's still anxiety and behavioral changes, low mood, and even grief. And just so we're not going to go through this, but I want you to know that we really do have resources. If you're seeing children or families are dealing with this, here's the list, right? Here's the list of at least, I only put 2 to 3 resources under each one, because what you don't need, what you actually don't need is a list of 400 resources, right? But at least some resources here. So you have those here, and hopefully that'll be helpful as we move forward. So you're doing all of this. You think it's working. You're trying to make it better for families, for your own family. So when I'm looking at this and thinking about this, this is not just other families. Some of this may hit home for your own families. So we've talked about the primary care interventions. A lot of what we're talking about today can actually be dealt with from a primary care perspective. Some people talk about the common factors approach. It's called HELP, H-E-L-P. Hope, empathy, language and loyalty, permission, partnership, and plan. That's how you approach this with families. That's how it works. So that's the common factors approach, but brief interventions can make a difference too. What we have to do, though, is when it's not working, is we have to look at the referrals, right? And we're going to talk a little bit more about that in just a minute. We've talked about telehealth services. That's great, right? You still want the children and families to come in to practice when it's safe, and it's safe now, we say. So get the kids back in to be seen by you all. That's really important. I will tell you that the telehealth services, that's a lot like the internet, right? Again, big talks with people in Oklahoma, they're like, well, you can say telehealth, but in the rural areas, it's telephone that we're doing because it's just so hard. However, telehealth is wonderful, and we've learned so much from it. And I think what we're trying to learn in this COVID is what have we learned that can actually help us moving forward? Do we actually go back to everything being the same way it was before? Or what have we learned about telehealth services, and how has that helped in rural areas or helped in access? So this referral and follow-up, I alluded to it a little bit earlier, but the child abuse and violence, one of the things that we know and we're afraid of is that child abuse may not be getting, we may not be seeing the reports as much as before. And part of that is loss of contact with teachers and loss of contact with us. So we have to be very vigilant, excuse me, very vigilant. And we also have to really think about the intimate partner violence and what's happening. We need to really be asking about guns in the home, which we always do, not gun control, gun safety, right? The parental mental health and well-being. And then I think we really have to be thinking about discipline. Everybody's stressed to the max. So if you're already stressed, how are you disciplining the children correctly and not physically disciplining them? And we talk about positive parenting. All right, one other thing, and we're getting through a lot of this higher level discussion. So how many of you know people who you've lost to COVID? Unfortunately, with my numbers, they're going up, and I think that we all need to really look at loss and grief, and some families really need that special attention. I'm going to spend a little bit more time talking about depression and suicide screening and prevention. So hold on that for a minute. So here's the summary from what we just said. We don't need to have all the answers. We have to help ourselves and parents to be gentle with themselves and their children. We have to know how to manage some of the fears and stresses, and they don't need to have all the answers. But here's the other thing. This crisis dynamics, and that's what we're looking at, they change quickly. So follow-up is really important, and having that ability for families and others to be able to reach out to you. So there's the immediate further action that's needed. You have to know the mental health providers. You have to know the community resources, and that's not easy. Although you've had a lot of good work over the years in looking at medical home and the resources there. So use those resources, right? Connect with the emergency services. Looking at this. So stay tuned for this. We just a week and a half ago had a virtual summit meeting on youth suicide prevention. There'll be a blueprint that'll come out from that. And if that just goes with some action steps, if that just goes, on just to your library, we will have failed with this prevention. I also know that you all are doing a lot in Utah to address youth suicide prevention, and we are actually learning from you all, we at the Academy, on some of the good things that you're doing and how we can spread that to other chapters in other states. So stay tuned on getting this specific information. Wow, so that's a lot of talking, a lot of resources. I hope that when you get a chance to look at them. But here's the bottom line. Here, the single most common factor for children who develop resilience is at least one stable and committed relationship with a supportive parent, caregiver, or other adult. Isn't that something? We know this, but that's so hard. Not every child has this, that stable and committed relationship. So that's what we're asking for. And here are some more resources. don't know why this is, sorry y'all, I'm having a little bit trouble with it moving on its own. I promise I'm not touching anything here. I want to go back for just a minute. Forgive me. So there are a lot of resources for pediatricians and families. They're here. I want to just remind you about healthychildren.org. So that's a great resource for families. A lot of families are using it. And in this slide deck, I just have listed some of the resources that are on there for families. I asked some of the numbers in the last year with healthychildren.org. We've had 108 million total page views. So there are a lot of families who are liking this. There's a lot of work that's going into it by staff, but by all of you. And we have Healthy Children in Espanol. So the screening time talks about tuning in to the needs of families. The STAR Center talks about social determinants of health, and anyone can reach, can access, particularly the healthychildren.org. So here are some of the resources on healthychildren.org. Wow. So just take a look at some of this. Working and learning from home during the COVID outbreak. Co-parenting through COVID, putting your children first. Challenges and opportunities for teens. So I don't have to read all these to you, but they're there, and I wanted you to know about those. So for us, too, there's a pediatric mental health minute series, and this is free, and these are 20 to 30 minute video series on mental health that looks at screening tools and mental health in infants. You can read that. Trauma-informed care, anxiety, all of those. So one more resource there. Here's the neurology, right? Put families at the center and look at the community synapses. So I think about federal agencies. I think about the Maternal and Child Health Bureau in Utah. I missed that. I loved it when I was there. But we also have to look at businesses and faith-based groups and education. Are we working with education? We could spend a lot of time, I know we could, talking about education and going back to school and what that means and those kind of things. Our board just had another meeting last night to look at the information that just came out from CDC recently on returning to school. So you'll be hearing more about that as we move forward. Okay, take a deep breath. That's a lot. So I'm asking you to take a deep breath. So this says health and well-being of physicians. It doesn't have to be physicians. It's caregivers. It's those of us who are providing services to children and families in whatever area. So hang on with this. I know too, I heard this morning that you all have not too long ago had a grand rounds on resilience. So this will just be a follow-up. It's not a lot. We're wrapping up, but I cannot give a talk on well-being and not talk about your well-being and my well-being. All right, so here we are. Burnout. We've been talking about burnout for a long time, and that's in the literature. And a lot of people now are saying in the literature and otherwise, stop using the term burnout. Stop. What we're saying is this is not an individual level problem. So burnout is not just about you do it better, right? As an individual, you just need to do better. That's not what this is about. What the problems are about are organizational policies, payer environment, some of the learning environments, organizational culture. There's still inequities in medicine and our whole culture of medicine. You know, you just need to be strong. You just need to do better yourself. Don't reach out for help, right? Don't ask for help. Don't go there. That's the culture that we're talking about that has to change, right? So we started looking at COVID stressors. See if this rings true to you. Here's what we've heard from our members. So now we're having the vaccine, although a lot of us haven't been able to get that vaccine yet, but the fear of being infected. A while back, we were worried about the fear that we would infect our family. People were angry about the working conditions and afraid about the working conditions. When we talked to pediatricians who are running an adult ICU with adults on ventilators, where they had to step right in at that, they didn't feel comfortable doing that, but they did it. So the big issue now that we're talking about are financial worries in practices and with family members, what we call moral distress. Here's the one: self-preservation, so survival versus sacrifice. And you all are sacrificing, right? It's what we do. We sacrifice. That's why we went into medicine, to help others, right? And then finally, just the exhaustion and overwork. So we ask places, that's the Pediatrician Life and Career Experience Study. So we asked them this summer, what are you dealing with? This was from 2017. This was a survey that we did then, and we said, what strategy would help reduce physician burnout and enhance wellness? And a lot of you may not be surprised that the first one was fix the processes, help reduce administrative task burden. That was 67%. Processes to improve workflow efficiency, half said that. And then you can look on down. A third said can be some programs that promote self-care. So here's what we asked this summer. What is the financial impact on practice? 2/3 reported that the clinic visits were significantly down. A third reported they were down more than 25%. So there's a financial impact on practice, and there's a financial impact on family. And please know that we have been looking at advocacy at every level to get funding for primary care and for subspecialists, and with variable success. I will just say that, but we hear you and we're doing this. And in the midst of all of this, you all are still concerned about what's happening in your community. So 95% are concerned about the social and financial impact of COVID in their community. Some very strongly that. And this I put in just as an aside a little bit. This was the summer. 1/3 have a colleague who's been infected with COVID. We have not asked again. I'm guessing, unfortunately, that may have gone up. Just quickly, because we have this open-ended and people can comment back from places. If you look at this, one doctor said, I transitioned permanently to part-time because I had to care for my children. Excuse me. Another one said, COVID had a major impact on the financial stability of my practice and thus myself. As a doctor, I never thought I would be without a salary. You can read the personal instability to the patients, that caring. And then this one, let's see if this rings true. Having to be a full-time physician, a full-time mom or dad or fill in the blank, aunt, uncle, whatever, and full-time teacher during the surge was unbelievable. We didn't have childcare because people didn't want to babysit for a physician. Thankfully, my clinic was gracious and allowed me to bring the kids to work. I felt pulled in all directions and didn't do anything well. So we knew this before COVID. The issue with suicide of physicians is significant. Unfortunately, I believe most of us know a physician personally, know someone that we cared about and loved who committed suicide, and I know that that's happened in Utah and with people that you know. So there's a big, this is the National Academy of Medicine. Here's where you go. It's National Academy of Medicine.edu, clinician wellbeing. If you think I have a lot of resources here, there are a lot of resources on the NAM, as we say, website. I'm going to tell you three things that quickly that we're talking about with the National Academy that they've put out. So this just came out, hot off the presses, supporting the health and well-being of clinicians during COVID, and there are strategies there for healthcare leaders and strategies for clinicians, and there are a lot of resources there. So let me just pop up. There are 8 top strategies for healthcare leaders, and let me tell you, this collaborative that we're talking about on resilience has over 150. I don't know the last number, groups that are part of this collaborative. So it includes physicians and nursing groups and pharmacy and many other groups that have been a part of this and are a part of this. So here's what was up. For healthcare leaders, we need to value clinicians, communicate best practices. And it's easy to say, right? Promote clinician well-being, a supportive environment. And you can read through this. I really looked and clicked on the one that said, ensure clinicians aren't required to return to work during dire situations. And I actually thought about that, and I thought, well, there are a lot of dire situations. But part of that is they're not required to turn to work during a dire situation at home, right? You're working in dire situations, but what's happening at home is so important too. Resources. Here's what they said that we need to be doing for ourselves. Easy to say, harder to do, but worth looking at, I think. So think about your basic needs during this time. Take breaks. Sometimes that's easy, sometimes it's not, but try. Stay connected. Respect differences. Updated self-check-ins, and really honor what you're doing. And again, there are many resources there. So we have a lot about wellness at the Academy, and a link to that is here on individual resilience, practice environment, advocacy, and learning environment. So here's the link, Pediatrician Wellness website. A lot of resources and individual wellness plan there. So one of the things that we know and we've learned so much from this is what might make me well might not make you well. What might make me well might not help you. So there's not one size fits all. Some people are really good at mindfulness and meditation, and that's wonderful. Some of us aren't so good at that. So I think that we have to seek our own resources and help in different ways. So Carol Weitzman, many of you may know, some of you may know her, chair of the section on behavioral and developmental peds. I love what she said. Your conversation with a family or a colleague, I added that, may be the lifeline they need. Your conversation with a family or colleague may be the lifeline they need. You don't know when just asking the question of how are you doing and then waiting for 3 to 5 minutes to hear how they're doing. You don't know what a difference that can make in someone's life. So when we are somewhat physically and socially distant, I would say reach out to others. Just reach out. You don't have to fix it, but maybe we can just listen, and that'll make a difference. So we heard from the beginning that adversity can have lifelong experiences. I would say to you, as I said at the beginning, now, more than ever, your impact on children, youth, families, and colleagues can be and will be meaningful, tangible, and forever. Thanks so much for having me. Please take care. And I'm happy to try to answer some questions if we have a little bit of time here.
Yes, Dr. Tait, thank you so much for coming. And, you really expressed the loss of this year, the loneliness, what kids have, the sickness itself and fears about it, their family finance and poverty, and their basic needs maybe not met, their worries, the increased screen time, fewer opportunities for touch points for help for children who have the behavioral health needs or to detect child abuse. And so, and then bringing it home, I mean, with doctors and nurses personally struggling as well. I like the all the resources, the strength-based care, screening for the social determinants of health, which now includes the connectivity, finding the strengths and resilience, and checking in on each other as caregivers, and if you or a loved one are struggling and need emotional support, you can call the Utah Crisis Line. I put that number in the chat as well. So to start with the questions, the first one is, most of these are expressions of gratitude. Angelo Giardino, who's our chair, says, Dr. Tait, welcome and thank you for being our Grand Round speaker this morning. That's a comment. He put it in the very beginning. There are some who are asking for the resource list. Do you think it would be okay if we posted this PowerPoint with all the clickable links in the Pediatric Grand Rounds archive under the recorded video? Would that be okay?
Oh, that's exactly what I would hope you would do.
Okay, excellent.
Those resources, and in this, we check them. It should take you directly to them. So the links are there, and I flipped through a lot of it. Right, I will tell you, I went back and forth about should I list all these resources, but they're there because I don't want you to have to go looking for them. So hopefully that'll be very helpful. Thank you for asking. That's excellent.
And then,
if it's okay, we'll also post them on the medical home portal, which you may remember having been part of the inauguration of.
Yep. Excellent.
Yep.
And a bunch of people are saying hi as well. Like Karen Bushai says, good to hear your voice. And Gita Larson, nice to hear from you from Gita Larson. A great overview for our patients and workforce. And Dr. Mark, I think that might be Mark Febb. It might be Dr. Valentine. I get it now.
Oh,
Mark Febb 14. Yeah, Mark Valentine. So thanks, Fan. Nice to see you again. Okay, and one person asked, Tracy Karp, when my grandson asks, will I always have to wear a mask? What do you suggest responding to a grandson? I guess it depends on the age.
Oh, so that's a great question, right? I'm asking that same question of myself. Will I always have to wear a mask from here on? And I guess what I would say, and I don't have all the answers, but I would just be as honest, like you're saying, you just be honest. You say, this is what I would say, and it may not be the right thing, is, you know what? I'm not sure. I'm not sure how long we'll need to wear masks. I don't think that we'll always have to wear masks, but for a while, we're going to have to continue to just be really safe and cautious. And we hope that that soon we won't have to do this. And I think I would just be honest and say, I don't know. I actually don't know how long, but there's hope because it depends on how old your grandchild is, of course.
Yeah, you said 7 years old. So, Yes, maybe you say when you're 8 or when you're 9. We'll see.
Yeah, like we say other things. Well, we'll see. Well, that's a great question from a 7-year-old, right? Mm-hmm. They're tired of wearing the mask, just like all of us. But I think I would just be honest and say, I don't know, but we're getting shots, and we hope that when the vaccine works and we have enough of that we'll be able to stop doing it. But for a while, we're going to have to continue for months more. That's what I would say.
Excellent.
I wish I had a different answer. Sorry, Al.
Thank you so much. Thanks again. So that's the end of the hour, and the claim credit code is 7952. We'll wait a little bit more because of the tape delay of about 10 or 15 seconds. I'll wait a little bit more, see if other questions come in. And so we'll stay here. And Dr. Norland, do you have any other questions?
I don't, but thank you very much, Fan. It was a wonderful talk, and it's great to hear you and see you.
It's such a privilege. I wish I could be there with y'all. I miss y'all. So thank you so much. And Chuck, I thought about, you go to that medical home portal because that's where a lot of resources are for Utah. I'm sorry I didn't say that in more detail there. Thanks to the good work. Thank you all. Thank you all for having me.
All right. Take care. We'll stop the broadcast. And Chuck Pruitt says, thank you so much, Fan. We miss you in Utah.
Yeah. I miss y'all too. I really do.
All right. We'll conclude that broadcast, and then we'll just have the claim credit slide up there.